There is nothing worse for a family sitting at home at 2 in the morning with a sick kid, trying to decide whether to go to the emergency room or not, when one of the factors is we don't have health insurance. If we go, it'll be $1,000 just to walk in the door or whatever it is. Families want to do right by their kids. It's just a whole lot easier to do it if they have health insurance for those children.
A program like Medicaid is there to really help the health care piece of the overall health of a population.
Low-income Arkansans, most folks don't have access to insurance through their job. Most don't have any leftover money to be able to buy some sort of private insurance. So Medicaid is the main way that low-income Arkansans can have any access to health insurance.
And we know that when you have insurance coverage, with it comes a level of benefits, medications or child visits or immunizations. And when you have coverage and benefits, you have health, or you can at least work towards health. And so Medicaid fills an important role in our state and in every state to fill in the blanks between a person who can buy insurance through their employer or a person who buys insurance on their own, provides that coverage for folks who don't have the money to do that themselves.
What we have seen is that people were suffering. They just did without, and they were sicker than they should have been. They finally got health insurance. They came into the doctor. Now, they were behind at first, but after being on a policy for a while, they were able to get the kind of preventive care that has really helped so many, hundreds of thousands of Arkansans.
I mean, I had clients who for the first time could get rotten teeth pulled, who for the first time experienced life without that pain. Many of our clients were thrilled with the ability to be able to suddenly go and have their own doctor. It was nothing short of a miracle for many of our clients.
You know, Medicaid has been really important to Arkansas for kids in particular, and I am really proud of what Arkansas has done in the name of Medicaid for kids.
Between our kids and CHIP, the Arkansas uninsured rate for kids has fallen to a historic low of 4% in over a 20-year period between 97 and 2017. That is tremendous. Almost half the children in the state of Arkansas, or around half anyway, are covered by Medicaid. So that's a lot of kids that wouldn't have the coverage if we didn't have those funds available.
Well, Medicaid has been a godsend for Arkansas, for Arkansas families. It has enabled people, and particularly those with young children, to have health insurance. And it's just vital in a modern society that families have access to health care and health insurance.
It wasn't for no reason that, grandmothers or older people or grandfathers or whoever say, if you have your health, you have everything. There's a reason, there's a grain of truth in that statement, and this is that you need to be healthy in order to be able to do all the things that we all think are part of having a decent life, so that we can be there for our family and friends, so that we can work, so that we can volunteer in our communities. Being healthy is foundational to all of that.
Our elected officials here in the state of Arkansas have a pretty good track record of understanding the needs that Medicaid provides for, and recognizing the impact of limiting Medicaid, what that would do to the communities across the state. We would encourage people to support their elected officials and promote to the state the importance of keeping Medicaid. If you don't have to worry about your health insurance, it makes life so much easier in a lot of other areas.
I think we come out ahead if we look at Medicaid from two different perspectives. One was from the perspective of an individual. I want this child to do well. I need them to have good access to care, and Medicaid or our kids is a way for them to get it. That really helps that kid, which helps that family. On the other side of it is all of us together. We don't do well as an Arkansas, as a society, if we have a whole lot of kids and parents and families that aren't doing well and go without health insurance. So to me, we think, Medicaid is a program for people with lower incomes. Yes, it is. I look on Medicaid also as a program for all of us because it helps all of us. The healthier we all are, the better we all do.